me think first. Are we live? Ready? Welcome everyone to our another episode of our free webinar. So today it's our free webinar for English session. Tomorrow we are going to have our Mandarin session, and then the day next is going to be Bahasa Malaysia session. So my name is Joanne, together with, of course, Dr. Edward Chan. Now today we are going to talk about adolescence. We're going to talk about the counseling for adolescents and also adolescents depressions therapy. We also know that, recently we read a lot of news. Cases of adolescents committing crimes are actually increasing.
Murdering,
Yeah. Yes, the murder case, stabbing
stabbing
cases.
300 times.
So we want to know, is it because of the depression, or is it because of is our principal psychologist of International Psychology Center, and not forgetting he is also the lab director of our Well Lab Center. Now, just a little bit of background about Dr. Edward is that he's actually a expert with a PhD in psychology, supported by master's degree in both learning science and nutritional medicine. He is also a fellow of the Malaysian Association for Psychotherapy and the World Council for Psychotherapy. And of course, Doctor has written a few books, and he has been invited to all the international stage to be a speaker. To find out more, you can always look into our www.counseling.com.my for our website to check out more.
Counseling with 1L.
Yeah. You see? So this is why he is the principal psychologist, and this is why I'm just a committee member. Okay, so doctor, for today, we are going to do 4 different segments. The first segment, we're going to talk about understanding the field, which is adolescence counseling and adolescence depression therapy. Now, the second segment, we want to focus on why these issues are increasing. So, and then of course, we're going to look for solution, right? So the solution will come in at the segment 3, which is why all these causes matter. And then the segment 4 will be our last segment, which will be talking about certifications and professional bodies as well, which is our MAP, so on and so forth. Because a lot of people...
For the accreditation of the courses.
Yes,
because
correct.
we do need to train more therapists in this field.
Yeah. Do you still remember what are the ratios of how many?
Not enough.
It's one over 85,000.
Something
The
like that.
last data I found out is that one clinical psychologist over 85,000 populations for one. Yeah, that's
But
yeah.
of course, we want to include all mental health professionals,
Yes.
not just clinical psychologists,
Yes.
counseling
as well.
psychologists, counselors,
Yeah.
psychotherapists, even social worker.
Yeah.
Right.
So I believe some of you guys who are watching, whether which is on our Zoom or either Dr. Edward's Facebook page, right? So, Doctor,
And
can you...
IPC Facebook page, right?
Today it's only your page and also Zoom.
I see.
Zoom page. Okay, so just a quick one. I think a lot of people still mistaken about the differences between a clinical psychologist, a counselor, and a psychiatrist. Can you just
And
briefly...
a psychotherapist.
Yeah, and a psychotherapist. Can you just give a quick breakdown on this?
Well, the first thing is, of course, psychiatrists are medical doctors. They are licensed to prescribe medication. Normally, for mental health, that will be psychotropic drugs, right? And in Malaysia, anyway, they are not normally trained in counseling or psychotherapy.
So, which means they just walked in to see the psychiatrist and said, I think I'm having a depression.
Yeah, so they are trained to use something called DSM-5. It's a diagnostic manual to look at symptoms and make a quick diagnosis. Right, and then there is all sort of different psychologies: clinical psychologists, cognitive psychologists, counseling psychologists, right? So educational psychologists, of course. So they these psychologists are trained further in doing assessments, right? So, like in depression, for example, instead of just the DSM-5, there are various psychometric tools that we use. Like, for example, the something called personality assessment inventory, which IPC psychologists and counselors are trained to do. This is an inventory that is more objective, because if the DSM-5 is just based on your subjective, the psychiatrist's subjective experience, whether the symptom is there or not, right? So there's something called almost like a lie detector in there. We ask the instrument asks many questions, same question, but from different angles. If there's a great inconsistency, we suspect maybe the patient is doing what we call malingering, in other words, lying. So they are manipulating the answer for certain gain, right? For certain gain, maybe to get some monetary because reward,
Yeah, I
right?
gotta stop you there for a little bit.
Mm,
While like people like us, of course, we know the assessments and how to get away with it. But for some people are actually kind of smart when they look at the score. One
yeah.
to five, 1 to 5. If they
So
want to get away with it, how would you determine whether
okay,
it's one person are actually lying?
indeed. So that's why in today's segment is on IPC, International Psychologist Professional
Yes,
Certification courses,
right.
right? So that is why we have different levels of courses. So at the
Mm,
level 1, basic level, we will teach simple assessment like using the DSM-5, using some screening tool, right?
mm,
But these are just pointing out indicators. It's like you are doing your self-test for your COVID, right? If it's
mm.
positive, it doesn't mean that you have COVID already. You still need to go to do a PCR in the hospital or clinic or something. So this is where the more advanced courses, we will train you to do the more objective tests at the PAI that I mentioned just now, which will then have the able to give you the more objective answers. Like
Yeah.
I mentioned, if there's a great inconsistencies for this question, asked in many different angle, then we know
Yeah, I
you.
think one of the things, because to our viewers who are watching, actually I was one of the students as well from IPC. I think when it comes to my final report, there's a section which is called subjective observation, and I was like, yeah. So there are many different aspects. It's just not only looking at the score, of the question and answer. Sometimes we, of course, from IPC. They've always teach us how to look at the way they answer, how a person's hygienic does matter, and even though the choices of color of clothes sometimes they wear, it does matter, does it?
The
The,
choice of
the,
clothes.
the no the choices of, like, in terms of hygienic, the
Yeah. I
hygienic,
mean,
yeah.
if the person doesn't shave and in a shampoo, probably that is an indication of depression, right? Is not able to groom himself. So we're a bit like Sherlock Holmes, right? You can like detect
Yeah. Wanted to be a
various
little bit of
signs.
clever, but for me, the reason why I joined the courses was I wanted to understand why people behave the way that they do behave. Okay, so doctor, let's come back to the adolescence counseling and the depression therapy. I would like to know what exactly is adolescence counseling and how is this different from adult counseling?
Yes, I mean, counseling uh, can be targeted at different what you call lifespan,
Mm.
right? From children to adolescent to adults to couples, family, and the elderly. So this is potentially different segment of a developmental lifespan, right? Which has different needs, different developmental profile. So for teenagers, they are at a period of the time where there is a lot of changes in their life. Hormones are now raving, changing. They have
Even the voice are changing as well, right?
yes, they suddenly have all these huge interest in the opposite sex or same sex, right? In sex.
Are we allowed to talk about that? I think it's really 2026. As long as don't ban my life lah, on Facebook. I think these are the thing that the more taboo it is, the more that people are not getting the educations on that. So let's just be open about it, right?
Indeed, because these are real cases that patient come to see us at IPC, right? All these
So
issues of
are
teenagers.
you saying that for adult counseling, it's more kind of like coming, it's more kind of like straightforward. Like I think I know, but I don't know at the same time. But however, teenagers, adolescents, a little bit complex. Like I have not figured it out, kind of thing.
Yeah, I mean, of course, a lot of adults haven't figured it out too, right? So there is something called, I mean, we know the physical umbilical cord, right?
Right.
When you're born, the baby, you need to cut the
The cord.
physical cord, but there's also a psychological umbilical cord, right? And it is most often cut during teenagers' time, right? So we know teenagers are very rebellious, right? So rebellion is at the peak, and we think this is a nuisance, but no, this is actually a very critical part of the evolution. It is important for them to be able to say no, to differentiate from their parents, in order for them to be independent and survive without the parents, because one day you're no longer going to be there for your daughter, and it's important for her to be able to manage without you, right?
This is why I push her out. I'm kind of like an Asian tiger mom. This is why I pushed her out when she was at the age of 19 and she already gotten her first job, actually. I actually felt kind of
Yeah,
guilty.
but not only
in that.
that, it is important for her to be able to have boyfriend that you don't agree with, have friends that you don't agree with.
Wow, I felt kind of attacked. I felt attacked. Actually, doctor is always very kind that to let me have a little bit room of discussing about what worries me is that because my daughter, I would say, is a young adult. Okay, she is 22 years old. Of course, when she goes into even in school. Come on, if those any parents, if you are watching, tell me, do you have any teenagers kids that you're worried about, whether if it's a daughter or come on, even a son, right? You don't want them to come back and tell you that, hey, I make someone, pregnant and things like that. So do you have that? If you do, you can always comment, put your questions and let's have a little short discussion on the comment section as well. Okay, so do you think that teenagers sometimes some actually turns out fairly well? So what makes them different from others? Is it because of the childhood? Is it because of I'm not doing my parenting well?
Right. So as parents, we need to know that your role has shifted, right? When you parent teenagers, you can no longer directly control them. Unlike you cannot like ground them like when they're a child.
Go back into your room, face the
Yeah.
wall.
Yeah. So the more you try to do that, the more it will backfire, the more that they will rebel and resist you. So your role has changed to that of a friend, right? Whereby they will want to listen to you if you have influence over them,
Right.
if they respect you. In other words, if they think that you are important to them.
Of course, yeah. Of course, we as a parents, we are the financial, the minister of finance.
But that is control, right? You're
You're
using
using money to control. If you don't
exactly.
behave, you're not gonna
Right.
get. You don't get the concert ticket.
Yeah.
You don't get.
They will
Yeah. You don't get the
resent
iPhone.
Right.
So that's
Right.
threatening, lah.
Yes.
Wow, I
Yeah.
felt attacked again. So yeah, I can actually kind of agree. But what is a good parenting other than But
Well, we're talking
sometimes
about teenagers now,
yeah, the
right?
teenagers, yeah.
Yes.
So sometimes we know they wanted to do the not so clever decision. Of course, we can't say go ahead.
Well,
But Asian parents are like that. Asian parents like do it. do it?
So the important thing is, like an AI, we want to show the thinking, right?
Mm.
What is the thought process that go into you making this decision? Uh, you know, show me. Let me work with you on
Discuss.
on
Discuss.
that.
Okay.
Yes, and then
Yes.
maybe I'm not saying no, right or wrong. It's just that I have a little bit more experience in working things out, and now I'd like to you know offer you this resource. That's
Mm,
all.
mm, mm,
I'm
mm,
not saying no or you're wrong per se, but I like to check out,
mm, mm,
your thinking
mm.
process.
But what are the red flags, doctor? That when we look at our teenager kids, what are the red flags that we should look out for? That's question number one. And the next question is, when do you think it's really calling the SOS bell already? Like, okay,
Well,
this we need to send to a professional already.
so today we're talking about
The
teenage
teenager, yeah,
depression, right?
yeah, the depression and
Depression,
yeah.
yeah. So depression, red flags would be like that. There's a change of personality, right? You're normally maybe she's very gregarious, but suddenly she stay in her room all the time. Introverted. So there's a change of personality, right? Loss of interest in her normal things that she's interested in,
Mm-hmm.
right? Change in sleeping habits, change
Okay.
in eating habits.
Not going to college,
Right, yeah.
refuse to,
Mm,
and things like that. Why
indeed.
why do you think? I think back in my time, I'm talking about. Okay, I don't mind to reveal. I think it's in the late 90s. Okay, auntie already, late 90s. My college year, I think I'm still. Of course, I still go to. I still have that rebellious stage a little bit, like going out with friends, especially to the mamak stall. Why do you think back then we still don't dare? We still don't dare to do more than that. Why do you think now the things has changed? Why there are so much more cases of adolescence depression compared to my time? My time, I don't think I've ever hear any of my classmates have these things.
Well, that's an easy one. Uh, FOMO, fear of missing out, because of
Mm.
social media. We have social media here today, so you know, all the teenagers will look who like me, who doesn't like me, what's in, and they fear missing out,
Ye-
comparing themselves with millions of others. Not
oh,
only
okay,
not
okay.
only with in your time you don't have that.
Um,
You just see the girl next to you.
Oh
Maybe that's the only
yeah,
one you compare
yeah.
to.
The girl with the best pencil box or the girl with the
Right.
nicest school bag. That was what our kind of like how to say competition. Also now it was because of all the social media. Who's more prettier? Whose boyfriend is more handsome? Everyone
Mm,
put it out there,
right.
and I think back then our parents is more like they shape us with the slipper. What depression are you talking about? You sad? Are you sad? You go back to sleep. You wake up. You talk to me. I think now I actually have come into cases there where sometimes I look at them. I think they mimic.
Mm-hmm.
It's more like I see some of the teenagers is like I'm not cool if I don't have any mental if I don't suffer from any mental illness. I gotta have a little bit like the oh maybe I'm ADHD, maybe I am depression, maybe have anxiety kind of things like that. Have you ever come across things like this? That they mimic. Oh, if I don't have any certain type of mental illness, then I'm not cool kind of thing. Have you come across this kind of cases, doctor?
Well, that is possible. That is part of a social status to have some the mental issues, and of course this is popularized by a lot of films like Twilight, Bella.
You're sitting too far away, or else I'm going to give you the high five, doctor. I agree. I really agree. Yeah, you see what I mean.
Yes.
Sometimes movies can actually influence them. It's like I gotta have a little bit of, or else I'm not that cool kind of thing.
It's possible, but it doesn't mean that you know depression and a lot of mental health disorders for teenagers, and then others are not real, right?
Mm-mm.
So we need to look at those seriously.
Mm-mm.
Uh,
So what are the traits of a teenager's depression?
right, like
Is there in DSM-5?
yeah, of
So
course,
they follow the adult
yes,
assessment as well in
mm,
that. Okay.
yes,
So
yes,
there's a period of you gotta feel
yeah.
down for 2 weeks
Well,
and stuff like.
empty, more than down. Yeah, listless,
Yeah. So I
right?
would really, suggest this to parents that, sometimes I understand that we as a parent we really do love our children too much sometimes and okay. These questions, doctor, I need to ask you. If let's say I have a kid, I have a teenager that I personally feel that my kid is not doing very well. Maybe I suspect my kids have depression, but my kid is very reluctant to seek professional help.
Mm.
How is it going to work? Because if let's say I drag my kid to come to your session, how are you going to do the session then like that?
Right. Well, I mean, let's not to start with assume the kid do not want to seek professional help, right? Surprisingly, we do have a lot of teenagers as us
They do ask.
that do ask their parents to bring them to see a therapist, psychotherapist,
Mm.
counselor,
Oh.
So there are those, but of course that there are those that are resistant. So then we need to understand what is the reason behind those resistance. It could be because they fear their friends will find out, right? Or be because that there is um, a certain what we call schema or psychological program, right? Like for boys, seeking help is considered weak,
Weak, yeah,
right?
yeah.
Opening up, there are probably uh, more girls that are willing to open up, right? And of course, the psychology center, like an IPC, we need to match the therapists with the teenagers. So if we have a teenage girl, then we want to provide a female
Okay.
therapist that will be more compatible, congruent. And
Yeah.
of course, in a multicultural society like Malaysia, then we match also on culture, on religion, on
Okay.
race
Okay.
as well.
Will the parents sit in on the first session together with the teenager? No, it's separated.
Yeah,
It's
totally,
separated.
totally,
Any
totally.
reason?
Yeah, because that there might be a lot of issues that teenagers want to share that they would not feel safe. Uh, that the parents knowing. Indeed, one of the very first thing you want to tell the teenager is this session is PNC totally not going to be revealed even to your
To your
parents,
parents, yeah.
except in the case of your life being threatened or other people's life are being threatened, right? Except for those cases, I might be obliged to break confidentiality
To the parents?
to the parents or to maybe even to the law.
The law, okay.
Mm.
So there are certain things that, as psychologists can and also cannot do. These, when it comes to life-threatening situations. How supportive do you think these days the parents are compared to many years back? Because many years back, let's say if I throw this to my mom, I think I have depression. My mom would probably just say, "You go and take 2 Panadols, you'll wake up fine." Or maybe she said, "Yeah lah, don't drink water." Mom, how is having
Yeah, I
depression
mean,
is not drinking enough of water?
yes,
Yeah.
with social media, with films, TV, I think parents these days are more
Open,
aware,
aware and open
right,
the
of
danger of it.
and also of the support from mental health professionals, that can help in this type of situations, right? So there are a lot of films.
Also, given the educations as well, so parents are more open up to
Indeed,
be willing to when the children tell them that mom or
yeah.
dad, if, I think I'm not feeling so well, because everything I think these days there are goods and bads, pros and cons as well, from social media. Even if, like us, we are doing the pros on Dr. Edward's Facebook page because we are giving education. We're talking about mental health, right? We are
Mm-hmm.
putting all the good stuff out there, and we're not, uh, it's a free webinar. So, has there been any questions so far? There's so far no questions because today we have Dr. Edward here. So if you have any questions in terms of if you are unsure whether your teenagers are having depression or any anxiety, you can always put it down there at the comment section. Doctor, actually, are you allowed? I think people like to listen more a little bit of the tea. Are you actually allowed to give some example of the cases you have done when it comes to teenagers' depression? Of course, we're not going to reveal the names and whatnot.
Well, yeah, I mean,
Has there any cases that you have done that you actually kind of still stick to you until today?
well, I remember clearly a case where this girl, um, her father just passed away, right? Due to an accident, something. So she came in and yeah, she was totally locked in silence,
Mm.
right? And and I told her that's fine. I'm here with you. This is your time. You can choose what how you want to spend it. So we will have whole sessions of silence, maybe even more than one session of silence. But then ultimately, she felt safe enough to open up, right? And
Hmm.
and I was able to help her process her grief.
How is it going to help if you sit there quietly, I sit there quietly? So this is needed.
Yes,
This
for
is
for
for.
for, for her to feel safe enough that I'm not. Well, she because partly because of that, she has this schema that I talk about, psychological program, fear of abandonment, right?
Okay. All right.
So why she's not opening up to me? Because she fear I'm going to leave her.
You.
Yes, I mean the father left her.
The father left. Yeah, the father
Yeah,
passed
not
away.
not 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 due to
So
so
wow.
so there's this program in her already. People will leave, right? People that support me will leave. So
Oh
I'm another like
wow.
supporting figure potentially. So she doesn't want to open up,
Wow.
and be hurt that I'm
Oh,
gonna
that is
leave her.
so
So I need to
sad.
demonstrate to her I'm here for
Okay.
you,
Right, right. So
right?
eventually, how many sessions do you have
Yeah,
to go through?
eventually we had about 12 sessions, and yeah, I
Now
was
she's grown
able,
up and
exactly.
happy, married,
Yeah,
and
I was able to, I mean, that is grief counseling, right? So when you go
mm,
through a grief process, right, teenagers will hopefully not many of them will lose parents, but they will lose uncles, dogs,
mm,
and friends, boyfriend, girlfriends, right? Um, in fact, that is even more difficult to process when you lose a boyfriend or girlfriend, because at least uh, someone died, they're no longer there, but you see your boyfriend with some other girl, so that 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 will bring up a lot of different emotions of not only sadness, fear, but
anger,
anger. Yeah,
disappointment.
exactly.
Yeah, but
Jealousy, right?
speaking about grief,
Hmm.
how different grief equivalents to depression? They are both related.
Well, I mean, depression and sadness is part of the grief process, but grief has many different type of emotions
Okay.
which need to be processed.
Okay.
So I remember, working with someone that has uh, been stuck in depression of grief for many years. And also, eventually, I need to help her write a goodbye letter and burn it to release her from.
Yes, this is one of the joke that I've seen them post on social media. What do I do, doctor? Write the letter and burn it. And
Right.
then I'm
So,
gonna come and say, what do I do to the letter now?
well, you already burn it, right?
Because I didn't burn the letter, instead I burned the man. Yeah, yeah. Okay, so that was one
Yeah.
of the.
So different emotions have different function, right? The emotion of sadness is actually to let go.
How do we know we are healed from grief, from depression? How do, whether it is a teenager, whether it is adult, how do we know we have healed?
Well, when you're getting back to doing things that you used to do, getting back your old personality,
What about still thinking
enjoying.
about that person? Is it still fine?
Um, right. So you're talking about grief,
Yeah, the
right?
grief. Yeah,
Yeah, grief. Of course. Yeah, like this teenager that lose her
yeah,
father. She's not going to forget her father
yeah.
for
Of course.
sure,
Yeah,
right? So, but the pain will be less, right?
more bearable.
Eventually,
Yeah, it
yes.
doesn't
Yeah.
get triggered that much.
Right.
You know, I think a lot of people's misconception about getting to see a psychiatrist, whether a counselor or whether is it a clinical psychologist, they will think that the unhappy moments will be erased. Actually, those moments, we cannot just erase it, but we can help you to uh, move around those.
Actually, we can help to desensitize it. So this is part of the difference between. Just now, you're asking what's the difference between
The grief.
a psychotherapist
Yes,
and
yes,
clinical
right.
psychologist and a counselor. So we haven't talked about therapy,
Yeah.
right? So psychotherapy have different modalities, right? It was founded by Sigmund Freud, who himself was a psychiatrist, but then he's founded psychoanalysis, which is one of the first psychotherapy technique. But there's a psychotherapy modality called EMDR, eye
Okay.
movement
Yeah.
desensitization, reprocessing, right? So what when you say we cannot erase like sad memory, a bad memory,
We cannot delete that.
we can in a way desensitize it. That's what we can do using EMDR, right? We desensitize it, so this traumatic, you know, triggering memory is not so triggering anymore. It's
Yeah,
sort of
yeah.
like
So
become a
bearable.
distant, yeah,
Yeah. So
yeah.
it's like the memories is still gonna be there. It's not gonna be erased. But when that come across your mind, you just don't go.
Yeah, it doesn't.
You know.
So it's very
Yeah.
effective for healing trauma, for
Trauma.
example.
Yeah. I probably
Yeah.
need that, doctor. I've been
Mm.
traumatized by so many men. Okay. let's move forward. Okay. Let's move forward let's speak a bit more about our courses.
Right.
How is the courses different from going to university?
Right. First of all, the courses are more clinical in nature. At university, I would say most university lecturers, professors, they're not clinicians, right? They don't practice. They might just come out from their master's or PhD
Mm-hmm,
and then
mm-hmm.
straight to a lecturing position. They don't have much
Just finish reading a book
preclinical
and then come out and just.
preclinical practice. Yeah, so our courses are more clinical in nature, where case clinical supervision, case studies, and you actually see opportunity to see real patients, right? And being
Mm,
supervised for that.
okay.
And our courses are structured in a way that enable you to get the full experience of being a clinician. So there are 5 different levels. At level 1, you'll be focusing more on general assessment, like you know, assessment of adolescence psychology,
Right,
right?
right.
And then level 2, it will focus on general therapy or counseling, like or teenagers counseling or teenagers psychotherapy. And then level 3 will be more specific, higher level of assessment, like depression assessment for teenagers.
Okay.
right?
More specific.
More
More
specific, and
specific.
then level 4 would be those more specific therapy, right? Uh, that's for example using EMDR uh, type of
So
therapy
is the
for
method like EMDR or
or CBT,
CBT?
cognitive behavioral
Yeah, yeah.
therapy, right? Emotion focused therapy,
I think a lot of
narrative
people,
therapy.
there are still people who thinks that walking into a therapy session is like just lie down on a couch.
Well, that was true for Sigmund Freud. He founded psychoanalysis, and he asked patient to lie down on a couch so that they are not too easily triggered. You know, they are relaxed.
Mm,
He
mm,
used
mm,
the technique called free association.
mm, mm.
Right, that means they're relaxed. He will say a word, right, and then
Because
then they
yeah,
will
because
remember
method
something.
of therapy right now, they are talking therapy. There are so many different types. Sometimes you even walk into a session that you see there are many chairs, and you're
Yeah,
probably
yeah.
wondering why. Like
So we do.
I thought I come in here and I just lie down on a
Yeah.
couch, but
So
eventually,
I
there are
mean
chairs.
like for this teenager, one
Yeah,
of the eventual technique I use will be indeed this. So put the father in one chair, and then you talk to the father.
yeah. Don't
So
try this at home though.
to close
Yeah,
any unfinished
yeah,
business she has with
yeah.
the father.
Yeah, so for those who are watching, don't attempt to do all these things what we talk about. You always need a professional to guide you through to do all this method. Okay? So for those who would like to sign up for any courses, make sure you reach out to us. You can still ask any questions you want to, or you can also check out our website. All right, and our course manager Uma will be happy to assist you, and even you can any questions you can ask today. We are here to assist you. So coming back into, I think a lot of people will be like, okay, since I'm not studying a diploma to a degree and a master's degree, so if let's say doctor, how many levels do I have to do with your course that I can actually be qualified as to go out there and practice?
Right. So if you depends on what sort of background you have, right? We have students with a psychology degree or even a master's degree in psychology or
Mm,
counseling
mm.
that come to do the course because they realize they only have theoretical knowledge but not clinical
Experience.
practice
Yeah.
experience, right? We have medical doctors, we have psychiatrists coming in to do a course. But if you have you know um, we have people from different walks of life, right?
Yeah.
From lawyers to housewives, teachers that do the course. So if you don't have relevant psychotherapy or counseling experience, then you need 3 courses from any level to get your general practicing license. After which you'll be like a GP, right? It's a general practice.
Mm.
You're not specialized, right? But if you're interested to further specialize, then you need to do 2 further high level courses
Four
with,
and five, level 4 and 5,
well, it can be 3, level 3,
level
4,
three,
or
four and
5,
five.
right?
So I
Courses
can be
so you can be like a board certified
hypnotherapist.
or board
Ah,
certified adolescence
right,
psychotherapist,
right,
right?
right, right.
Yeah. So
Okay,
this that just like you can be a pediatrician or dermatologist or oncologist, in
right,
addition, or
right.
psychiatrist, which is a specialist, right? In
Yeah.
addition to being a GP.
Mm-hmm, mm-hmm,
Yeah.
mm-hmm. Okay. So what you're saying is that if I don't even have a foundation in psychology,
Yeah,
is that
you can,
workable?
yeah, and we will recommend that you start with level
Level
1.
one,
Yeah, so you
the
learn about
general
the
assessment.
exactly,
What is psychology?
right,
Then
right. What
from
how
all
to
that.
do your
Yeah.
subjective observation, your objective observation.
I used to be the best student, but now I think I've given it all back to the school. Well, because I did not really practice lah. For me is more that I would like to understand how a person's behave and why they behave in such a way. And I thought I can manipulate my ex, but it's okay lah. It's always a knowledge, knowing something that, I mean, psychology has always been one of my passions, something that I really like to learn. So this is why I come across with International Psychology Center. And as an ex student, I find it very useful is that they are clinical supervision
Mm,
classes
yes.
where, I present my case, you present your case, and everyone needs to present their cases. So from all this, we get to see there are many different types of cases, people from all walks of life with different type of storylines. And of course, we will discuss with what are the therapy method.
Mhm.
Yeah, so some cases
You learn
were, yeah,
about case formulation,
yeah,
something
the
called
case
case
formulation.
formulation.
Can you refresh me about the case formulations again?
Right. So patient, like in this case, teenagers,
Yeah.
either parents bring them in or they come in on their own, right, with some problems. So
Mm.
this is what we call presenting problems,
Mm.
right? I cannot sleep, or I feel depressed, or I have no motivation to study. So all these are presenting problems, right? But we don't treat just based on that. We want to find out the underlying problem,
This
right?
is like the
So
iceberg, lah.
yeah, so
The
that
tip of the iceberg. Yeah.
there's a field of medicine called functional medicine. So we are
Right.
practicing functional medicine. What is you not eating a function of, right?
Okay.
What is your bulimia a function of,
Mm.
right? Maybe of your relationship with your father or something. So we want to trace back to the underlying problem.
So for an example, it's like the presenting problem is like my son can't sleep. Don't know why cannot sleep.
Yeah. So this is the difference in a way between like medical practitioners, right? You can't sleep, I give you a pill. Um, that doesn't like solve
It doesn't
the
solve. I mean, it works, but it just doesn't
for a
solve.
while
Yeah.
and until you need a stronger pill to
Mm.
to
So you find the true reason behind of it of why he can't sleep. He
exactly.
can't sleep maybe because I'm afraid of nightmare. There are many possibilities.
Even
Yeah.
even the nightmare is a function of something,
A nightmare is a function of something.
right?
Enlighten me, doctor. That's interesting.
Well, yeah, nightmare, is an anxiety dream that you're worried about, um, losing someone or something, you know.
Mm.
So, so that we have a therapy modality called dream analysis, right? Dream
Right.
interpretation.
Mm.
So
How
we
true? How true is this about this dream interpretation?
well, there are again different modalities,
Right.
right? For Freud, is always about sex, right? So you dream of falling. That means yeah, you want to have sex or something. So that is Freud. But there are other modalities
Right.
like Gestalt, by Fritz Perl,
Yeah. Yeah. Frisco.
right?
Yeah.
Yeah. So for him,
1972.
yeah, for him the dreams are all about yourself, the different dream objects, right?
Mm.
So like if you have a dream of what, do you remember any recent dream
I
you
do.
had?
I do.
Give
I
me
think.
one recent dream.
Um. Hmm. Ha! You see, doctor is trying to like know the tea I have. I think recently I still do dream of my ex boyfriend.
Right. So
I still do dream that I look for him.
okay. So say you dream you were looking for him
Yeah, I
where
was looking for him. I
where
mean, I was like,
what place is this?
uh,
You
whether
know.
it's in Malaysia, or whether it's in UK.
No. I mean,
Mm.
is it like a shopping mall? You're looking for him or what? Give me
Yeah,
the
sometimes it can be in. I think the recent one was. I think it was in public space. We were going out.
right,
Yeah.
and you lost him or something.
No, he just presented as very cold person to me that he wouldn't want to communicate.
Right, and in your dream, what was happening? You were trying to
I was trying to engage a conversation,
right,
you know,
and
and I was more like,
yeah,
wow, why has this person become so cold?
right,
Yeah.
yeah. So if you were doing a Gestalt dream analysis,
Yep.
then I would ask you to play him, be your boyfriend. What do you see, and how you feel, and also be the public place as well. What is that like? So you be each dream objects because in Gestalt, that believe all these are different projections of
Yep,
you,
I do agree.
right? So this is how you do. So different modality has different ways of using dream in therapy.
Yeah, I
In
mean,
other
I
words,
agree with what doctor said, but sometimes dream, I look at it in terms of when I wake up, I ask myself, how does that make me feel? How
right?
does that dream make me feel?
But more specifically, how does each of the aspects make you feel, right?
Yeah, yeah.
So you then you at the end of the day you will
Make my own judgment. Yeah.
understand more about yourself. So another very popular dream modality is Jungian. Who is a Carl Gustav Jung is a student of Freud that later
Yeah.
fall out. So he pioneered Jungian analyst technique, but also something called voice dialogue, who are training,
Right.
by
Right.
the Houston, the founder of voice dialogue, trained by himself and his daughter. So in the dream analysis, we see the different dream objects as your different selves, right?
Hmm.
So if you like dream of the boyfriend, he represent a part of you, one of yourself who is like maybe very cold also, right? Maybe your disowned self. He represent like your disowned self. We call it a disowned self because normally you are very gregarious, warm, right?
Yeah.
So then you judge people. So this is what we call your primary self. But then
Yeah.
you will judge people who are not as gregarious as cold,
Hmm.
right?
Yeah.
Yeah. So that will give you
Maybe
some.
that side, it's my it was my just let me live in the in deniable kind of side. Okay. I think we have another more like 5 more minutes to go. So doctor, just a quick one before we wrapped up. And other than the adolescence counseling, depression, all these courses, we do have adult courses as well. Any other
Yes.
courses that you think you would like to talk more about in these last 5 minutes?
Yeah, that definitely like especially related to adolescents and children courses, right? We
Yeah.
we have different type of modalities that are very supportive, like expressive art therapy,
Ah,
right?
that would be interesting.
Expressive art therapy, like teenagers especially are very fond of something called sand play therapy, right? So
Right.
we have a tray of
Right.
sands,
Yeah.
right? This is again influence of Carl Gustav Jung,
Mm.
who find that with a sand that can represent the whole
Yeah.
universe, the whole world. We have miniatures that I can use,
Yeah.
not only the good guys but the monsters, the
Yeah.
bad guys. So we were having to talk much, like for this teenager that I was telling you,
Right.
I was
Right.
also
Yeah.
using that enable the interaction and
Mm.
engagement without using a lot of verbal
Verbal. Okay.
language as well.
Actually, we do have a content about the sand tray therapy. We do have that. If you check out our social media, just scroll a little bit down. We do have a uh, yeah content which we talk about
Yeah,
that as well.
art therapy,
Yeah, the
music
art therapy, the
therapy,
music
dance therapy.
dance therapy. Yeah,
Mm,
for I think all these are just not
hmm.
saying that you need to be perfect in music, you need to be perfect
No,
in
they are different
drawing.
from
No, it's
music
yeah,
lesson or art
it's
lesson.
totally different from
Yes,
that. It's
everyone is creative,
mm,
so there's no bad art,
mm, mm,
right? So it's a way of processing your
yeah.
emotion and expressing yourself. Everyone can express yourself. But one last thing we need to talk about is recognition and
You're
certification.
right, right. I think a lot of people would also like to know. So after all this, the 3 levels and then also the 5 levels, can you speak more on that, doctor? I think you're more credible to speak on that part when it comes to all the
Yeah, so we
certification.
talk about board certified, right? By
Mm,
MAP.
mm,
You can be single board certified, double board certified, even triple board certified.
yeah.
So you can be a board certified adolescence therapist, but also a board certified art therapist at the same time, which will give you more credential and specialization in working with a teenager, for example. Right? So all these board certification, MAP, Malaysian Association for Psychotherapy, is a full member of the Federation of Natural and Complementary Medicines Associations of Malaysia, which is a designated body for professional practice by the Ministry of Health. of
Okay.
Malaysia. So we have the national recognition and accreditation, and of course, it's also all accredited by the Human Resource Corporation, right?
Okay.
As well for those more interested in corporate courses, adult
Right.
courses,
Yeah.
the HRD. See, you can get the HRD fund to do that as well, to do all the courses. And there's also international accreditation and recognition. The Malaysia, MAP is on the board of the World Council for Psychotherapy. Just last year, no, we had a meeting in Vienna. I was there, presented the various keynote as well.
Yeah.
We are also part of ISPCP, International Society for Psychotherapy, Counseling, and Psychiatry. Right, so there are various journals. You can go to, later we'll put on the YouTube the link.
Right.
So you can go to www.ijapcb.com. You can see various journal for free, free access journal of the previous WCP conference journals, or published there by top-notch psychotherapists like Joseph Moreno, the brother of the founder of the psychodrama, which is related to Gestalt therapy, for example. Yeah. So national and international accreditation
Right.
and practice, and your paper can be published in all these peer review
Yeah.
journals as well, right? So yeah, and we have institutions, all sort of other accrediting institutions.
So don't worry to all the viewers out there. You find this a little bit confusing. Don't worry. Our course manager, Uma, will be happily to explain all this to you once again. All you have to do is just look into our website and you can find any courses that you like. And if you want to sign up one, right, you can always WhatsApp us or either send us an email. We'll be happily to assist you. And doctor, I hear that you'll be traveling soon next month.
Yes, to the Colorado,
Yeah.
Denver, to the fourth World Congress on Existential Therapy, which we haven't talked
Yeah,
about.
we have no time to talk about these.
Existential
How about
therapy.
this, doctor?
Yes.
Next month, our topic, we will focus on adult. Right? So we
Yeah.
can talk more a little bit. We're going to find one topic that we're going to talk about when it comes to adult. You can always give us a comment which adult topic that you'd like to talk about. And then the month next, we'll be talking about couples. So we always take turns every month for our webinar. We'll give different
segment,
segment, different topic. So if you would like us to speak about any, if you find us, you go to our YouTube, you can look into, I've actually put everything into order. If you see there's one topic we have not touched on and you would like us and Dr. Edward to speak on that, you can always give us a comment. So doctor, we wish you the best of luck.
Thank you, and I hope to bring the
Yeah.
Congress to Malaysia in 2 years' time.
Yeah, in 2029 for that. So once again, to all viewers out there, thank you so much for watching. Any last message to given out to all the viewers today?
Well, the teenagers, your time with teenagers can be trying and challenging, and if you're a teenager, you can find things challenging, but do not be discouraged. It's an opportunity for growth, for learning, for connection as well. So embrace that. We are here to support you. So do reach out if you need any support.
Yeah. So this is from me. I think life is a journey. It can't be just one straight line. If you fall, always look for the closest one to talk to. And if you really, really need professional help, please do seek help. And we are always here for you. So once again, to all our viewers, thank you so much for watching and good luck, Doctor, for your trip next month to Colorado. And
Thank
we'll
you.
see you on the next episode.
Bye-bye.